Okay, so I'm happy to talk at the extravaganza. This is a really great crowd and wonderful talks. And I want to talk about some recent work in my lab that's actually different from what I think we're known for. In particular, I want to talk about our work in machine learning and deep learning as applied to computational biology and computational chemistry. So I think everyone here has heard of Moore's law, but I don't know how many here have heard of Eroom's law. I don't know if any hands. So Eroom's law is defined as the opposite of Moore's law. That's why I even capitalized it that way. And what it is, it's Moore's law is the exponential growth of power of computers, and Eroom's law is the exponential decline in traditional pharma of being able to do useful things like come up with drugs. That the cost of drugs and the number of drugs are exponentially decreasing. And this is really kind of terrifying because we all know the long time limit of exponentials. So we want to be able to do something about it. And so it leads to a fundamental question, which is that drug design is slow, often takes a decade, 15 years, and hundreds of millions of dollars. And is there something we can do about it? I'm both impatient and quite poor, so I'd like to be able to do something different. And in particular, for this crowd and for me, it's not a surprise that ideally we can use computation to do something about this. And what I want to argue is that I think the time has come that actually a grad student can actually do something really pretty fantastic with these methods. And I'll give some examples. That the goal would be is that during a grad student's PhD, they can cure a disease. And actually, I'll show you an example of actually one of my grad students who actually has potentially cured two. And maybe he's an outlier, he probably is an outlier. But I think part of it is that I think it's a particularly exciting opportunity right now, given a confluence of many things. Okay, so part of the trick here, and this is something we've done now for several years, maybe 5 or 6 years, but actually many people, including people at Stanford, like Atul Bhutt's lab, is also doing this. And the idea is to use drug repurposing. So actually, we all know that drugs don't hit only their targets. If a drug only hit the protein target of interest, there would be no side effects. The fact that there are side effects means the drug doesn't exactly do only what we're interested in. And so, so it's well known that drugs can perform many functions. And it's not just toxicology. Actually, it's interesting that, I don't know if any of you have taken Benadryl or also taken Unisom. It's actually, in certain formulations of Unisom, it's exactly the same drug. And actually the exact same dose. And one of the things I find particularly amusing is that actually at the Walgreens in Los Altos, near where I live, actually they're on the opposite sides of the same aisle in the generic. And the sleeping pill costs 4 times more per pill than the decongestant, even though it's exactly the same drug. And I think part of the reason why this type of repurposing is kind of unknown to people is that it's hidden by brand names. But if you actually look for the chemical formulas and things like that, it's well clear. So it's well known that drugs can perform multiple functions. That's actually not the question. The question is actually, given some function of interest, can we find an existing drug that would actually serve that function? And if we could, then the beauty of this is that then we would actually have a drug that is already past phase 1 clinical trials. So it could move immediately into phase 2 clinical trials. And most importantly, part of the real challenge for developing drugs is toxicity. It's actually now become relatively easy to get to the point where we can have a small molecule drug that actually works in a test tube, that works in tissue. But often when we bring it to mice or bring it to people, it fails. And that's why it's so slow and so expensive. And so the ability to repurpose lets us go faster straight to phase 2, but also actually helps along the way too, because we've already seen these drugs in mice, we can move quickly through mice. And in the case of repurposing we've done in my lab recently, the work I'm going to show, some of this stuff has been done in a period of 6 to 12 months. Straight from nothing through computation through mice into phase 2. And so, in particular, one of the things that we've been working on is to try to develop new machine learning approaches to facilitate this. And so this is actually still pretty early days, especially using deep learning for this area. And so I want to just give you a sort of a bit of a teaser for what we can do now and what we're thinking and hopefully where we'll be able to go. Okay, so the classic approach for doing repurposing, which actually we and others have I think, used reasonably fruitfully, is just to look at molecular similarity. And here's the idea, is that a common analogy for drugs is that we think of the drug like a key and the protein target like a lock. And the idea is lock goes in the key, and not all locks go in keys. But so let's say you have a lead compound, something that you hoped would have been a good drug. And it actually works in some ways, but it just happens to be toxic to humans. Like it kills a parasite, but also gives you liver toxicity or something like that. But so you have a key that's pretty good. What you can imagine doing is that if I actually gave you a physical key and said, find me other keys that would open the same lock, what you'd do is you'd put the keys up and you compare them structurally. And if it had similar ridges and so on, then it actually would probably have similar function. And so at a very simple level, looking at similar chemical structures actually goes actually surprisingly far to be able to predict similar functionalities. But it has some real serious issues, because the problem is that in a physical key, you can align them, you can see what's going on. But for a chemical structure, what makes two things similar? Is it the right atoms? Is it sort of functional groups? This question of what makes something similar is actually unknown. And there's some simple heuristics that people have. But being a scientist, and especially someone who likes statistics, it would be fantastic to not just have heuristics about this or guesses. It'd be great to infer this from the data. And this is where machine learning, I think, can help. And so, the primary challenges to machine learning are the fact that often, we have small data sets and imbalanced data sets, that often we have very few actives and many inactives. And then, even though I said that machine learning can help us, and especially deep learning, I'll argue, can help us understand the featurizations, we still have to be able to serve up the compound such that a machine learning algorithm can understand it. And this is still a big challenge. And while I'm talking about sort of drug design and biology right now, I think these are issues that are common to many areas in deep learning. And so I think some of the issues that we're finding now, I think, could be common in many fields. Okay, so why is there so much excitement recently? So most of the excitement, or a lot of the excitement, is centered around deep learning. And I want to review some work from Jeff Dean and Andrew Ng's group. And what they did was really interesting. So the idea of deep learning is that you start with a series of neural networks. And you can imagine the input data is coming on from the left. And one neural network feeds into another one, feeds into another one, until you finally get high-level results out. And so what they did is they trained this DNN on YouTube videos. And so went in with videos, and what happens is that at intermediate stages, you have sort of medium-level information, like you could start to see geometric data. And that at higher-level areas, these nodes correspond to sort of eigenshapes. And because these are YouTube videos, one of the key eigenshapes actually is a human face, which comes out automatically. This wasn't put in. It wasn't designed to find a face. That's something that's common in these videos. And of course, because these are YouTube videos, there's also cat eigenvectors as well. And so the hope is, because this has had such an impact in speech and vision and control and many other areas, and that these problems are similar in complexity and richness to the drug design problems, there's hope that something like this could work for drug design. And here now, it would be sort of drug information coming in, and at lower levels, instead of geometric information, would have certain issues for whether it's maybe drug-like or not, or whether it would hit a GPCR, a common drug target, or hit a kinase, a typical target for cancer. So this is the dream and the fantasy, and I want to give you sort of an update on where things are and why we think this is interesting. I think one of the things that's particularly interesting is a bit of a technical point, but I think is an intriguing one, is that in deep learning, it's easy to do what's called multitask learning. And so what is multitask learning is that we would have different tasks. And so what would tasks be in this case? Different tasks would be not just asking, is this going to be like a drug for cancer or a particular drug for Alzheimer's? That would be each of those would be a task. And so let's say we only care about a particular type of cancer. We would still train the model on many unrelated tasks. And the idea here is that by training on unrelated tasks, we get two things. One is that we can bring in a lot of information that's, that isn't just about our tasks of interest, but of basically incorporate everything we have. And the reason why this is important is that, like, if you don't have a lot of data, it's very easy to overfit. So if you tried to train a neural net about people who give talks at Stanford, given the data in front of you, you would say, people who give talks at Stanford have glasses and black hair or something like that. So that would be grossly overfitting. Maybe not the glasses part, and so the idea is that if you train on many things, such as you train not just on people speaking in this room, but people sitting in the room and all this stuff, you can avoid overfitting. And the idea here is that this type of approach actually has been very fruitful where we have broad sets of data, but maybe not in a given task. And this is perfect for this drug design area, and we expect it to be useful in other areas as well. Okay. So, why would we do deep learning? I think at a high level, and I don't want to go too technical, especially for the nature of this session, but it lets us do two things. The multitasking is very important, but also, really, it's been shown to be so useful in image recognition, video, speech, and so on. It's very tantalizing to see what we could do with it. But the key questions still remain. Can we come up with these featurizations, and we can build architectures? So actually, we have a preliminary paper out. I don't want to go into technical details, but the paper's on the archive if people are interested, and I can give reference for that. What I want to do now is talk about sort of some of the results in the concept of repurposing. And so these results actually are prior to our deep learning work, but I think will sort of whet your appetite for the types of things that could be possible. So one of the things that came up in our lab, and I think this is a common thing, is that we actually have been doing simulations, in this case simulations of protein aggregation for Alzheimer's. We developed a small molecule that actually seems to have been a potential Alzheimer therapeutic. It worked in a test tube, and we were really excited. But as what happens often, it turns out that this compound was also toxic. And this is a common thing. And there's an interesting sociological problem here, because I could take this compound and try to sell it to pharma. But a lead compound like this to pharma, if you ask them how much it's worth, they might even argue the sign of the number, whether it should be positive or negative. There's this psychological thing where they have their compounds, they have their baby, they don't want any more babies. Like, I would never sell you my 2-year-old for anything, but I'm not interested in buying your 2-year-old either. That type of thing. We love our babies and maybe only those. So it became clear that we have to do something in my lab. And so repurposing was something that I think has really caught on for our ability to do things. So this is a repurposed drug that goes after the same type of mechanism. In the case of Alzheimer's, it actually gets to the point where actually now it's a drug that's no longer toxic and has a similar behavior. This drug is all queued up to actually go into mice. It turns out that dealing with Alzheimer's and mice is actually a fairly tricky thing, so this is a little bit on hold. But we now apply it to many other areas, especially in infectious disease. And it turns out that mice models are pretty good models for infectious disease. So one of the areas that we've gone after in the past is Chagas disease, which I think many of you probably have never heard of, but it's a top 5 killer in Latin America. And actually, NPR had this scary title saying that Chagas disease is the new HIV in America. The reason why is that the way you get Chagas disease is this insect comes and it sort of kisses you, lays its larvae in you. And so even though this is not drawn to scale, it's still a very nasty, scary thing to have happen to you. And actually, eventually the larvae become little parasites and swim around your bloodstream and eventually eat your heart from the inside out. So not very pleasant. So it's a top 5 killer in Latin America. You might think, well, this is a third world disease. But there are many third world diseases that become first world disasters. So HIV used to be this African disease. Ebola, everyone was freaking out on Ebola recently. And now actually these bugs, due to immigration and global warming, are moving north. So 30% of all homeless men in Texas that were tested have Chagas disease. It's also in Southern California. So it's become a serious thing. So we were able to take, again, a lead that was toxic but that intriguing, do drug repurposing on it in infectious disease. We can actually go very quickly through mice. These compounds have already been in mice. And so this work also was done relatively quickly and has led to now a repurposed drug that is prepping for phase 2 in Chagas. And we've now applied this to Chagas, dengue, Ebola, and many other areas. And the exciting thing now is that these things can now be taken off and we can either do phase 2 clinical trials at Stanford. My preference is to do them outside Stanford because messing up a clinical trial means that drug might never make it to market. And so the grad student Paul Novick, who's done the lion's share of the repurposing work I've shown you here, actually co-founded this company Gobavir with me, and it's now into the company. And the Ebola and dengue drugs are now in clinical trials. So that's the main story here, is that I think it's an exciting time because we have new tools that let us do things that we couldn't do before. We have data that lets us do things that we didn't do before. And also we can move very quickly and do like real things, not talk about maybe someday this could help design drugs. This gives pharma some picture that they would be useful. I'm talking about drugs that we put into clinical trials. And this, I think, used to be sort of far off, but I think it's really within the hands of academics. So the conclusions, I think, first off, for the first half is that deep neural networks or deep learning is, I think, a very exciting area. There's still a lot of technical challenges, but I think there's a huge potential for great impact. I think there is very early days. But then secondly, drug repurposing really opens the door for new clinical impact. And so the work that I showed here on the deep learning side especially is the work of Bart and Stephen Kearns. Actually, Paul Novick's name's not on here, but he was key on the repurposing. And actually, Bart's in the audience here as well and probably can answer questions. And thank you very much as well.
It's very exciting and super impressive. What kind of compute power? It sounds like to do this kind of deep learning requires a very significant level.
Yeah, I think so. Although my lab is, we run folding at home, which has about 40 petaflops of performance using, roughly 100,000 GPUs. Compared to that scale, it's not necessarily that expensive. But we are talking about many, many GPUs to do these types of calculations. I think it's something that is within reach, but is still an expensive calculation. So a cluster of 100 GPUs could do reasonably well in these types of problems.
Julie, any other questions?
Yeah, what's your YouTube like? How do you get the data?
Oh, I don't know how it, that's Andrew and Jeff Dean's work. Jeff Dean is at Google.
And not your YouTube, but like they have, you know, a few tens of thousands of features. What's your idea of, oh, you're going to get that for drugs in the next few years?
Oh, so the idea here is that if we can come up with the right input featurization, the DNN would learn those features. It's not something we put in by hand, and that's actually the exciting thing. You have to what, sorry?
To feed the data?
Yeah, you have to have a lot of data. And so this is something where we're spending a lot of time to have relationships with pharma, and we collaborate with pharma to get data from pharma. There's actually also a lot of public data. Also on our minds is we do a lot of simulations, and with Folding at Home, we can do simulations and generate simulation data. So there's lots of different types of data that you can imagine getting. But data is, for any deep learning approach, data is really the problem.
More questions?
Okay. Great. Well, thank you.
Thanks very much, Vijay. That was fantastic.